Today, we're diving into the escalating overdose crisis and the crucial role that naloxone distribution plays in combating it. Let's get started.
Yes, this is such an important topic right now. What's the latest on naloxone distribution?
Well, there's this recent study that really caught my attention. It highlights how distributing naloxone to people at high risk is essential in tackling the overdose epidemic.
Right. That's the medication that can reverse an opioid overdose, right?
Exactly. But here's the thing. It only works if a witness accurately identifies the overdose and administers naloxone in time. The study estimates how much naloxone needs to be distributed in each U.S. state to reverse at least 80% of witnessed opioid overdoses.
Wow, 80% is a significant target. Are most states meeting that level of distribution?
Not even close, unfortunately. Nearly every state needs to scale up their efforts considerably.
Oh no.
Community-based distribution is highlighted as one of the most impactful strategies to achieve this.
So, when we talk about community-based distribution, we're talking about getting naloxone directly into the hands of those who are most likely to witness an overdose?
Exactly, especially people who use drugs themselves. They're
Yeah.
often the first on the scene when an overdose happens.
But isn't it also important to distribute naloxone to the general public?
It is beneficial, but evidence suggests that focusing on people who use drugs is more effective. They're
Right.
embedded within communities where overdoses are most likely to occur.
That makes sense. But, aren't we placing a heavy burden on them by asking them to act as first responders?
That's a valid concern. While many willingly take on this role, it can expose them to significant grief, trauma, and stress.
So, they might experience emotional tolls similar to emergency responders but without the same support systems?
Exactly. Some research indicates that the emotional toll can lead them to avoid settings where overdoses might happen to protect themselves emotionally.
Wow, that's tough. So, what can be done to support them?
Well, future efforts need to include support services like counseling and peer support groups.
Yeah,
It's ethically imperative to ensure their well-being.
absolutely. After all, they are on the front lines of this crisis.
Precisely. We should provide them with resources similar to what's offered to other public health and emergency professionals.
Right. Do you think current policies address this need for support?
Honestly, not adequately. There's still a gap between what's needed and what's provided.
Maybe there's a stigma that's preventing proper support from reaching them?
Definitely. Stigma plays a huge role in how society views people who use drugs.
Yeah.
It can hinder efforts to provide them with necessary resources.
So combating stigma is crucial in this fight?
Absolutely. Reducing stigma can encourage more people to step forward and receive support, which enhances the effectiveness of naloxone distribution.
Right. It's interesting how harm reduction has historically been practiced by communities of people who use drugs for themselves.
Exactly. Harm reduction depends on the idea that people who use drugs deserve to be cared for, valued, and supported.
But it seems like society often overlooks that aspect.
Sadly, yes. There's often a lack of recognition for the efforts these individuals make in their communities.
Yeah. Do you think involving them more in policymaking could help?
Absolutely. Involving people who use drugs in policy decisions can provide valuable insights and ensure that their needs are met.
Right. It feels like we're asking them to be heroes without giving them the proper tools and support.
That's a great analogy. We need to equip them with what they need to perform this crucial role effectively and sustainably.
Yeah. But realistically, do you think policymakers will make these changes?
It's challenging, but with advocacy and increased awareness, there's hope. Change often starts with conversations like this one.
That's true. Perhaps we can also look at successful models from other countries or communities?
Yes. Programs that have successfully integrated support for responders can serve as examples. It's
Right.
about learning and adapting best practices.
Maybe sharing personal stories from those on the front lines would make an impact?
Definitely. Personal narratives can be powerful in highlighting the challenges and the need for support.
Yeah. It's a complex issue, but addressing it is essential if we want to make a real difference.
Exactly. Supporting those who are directly involved is key to tackling the overdose crisis effectively.
Well, this has been an enlightening discussion. There's so much more to consider beyond just distributing naloxone.
Absolutely. It's about ensuring that those on the front lines are not forgotten and are given the support they deserve.
Right. Hopefully, this awareness will lead to meaningful changes in policies and practices.
Let's hope so. Together, we can advocate for better support and make a real difference.
Yeah. Thanks for shedding light on this important issue.
My pleasure. It's been great discussing it with you.
Yeah.